Hi everyone. For the ions activity that we had to do, I actually did a list rather than a chart. To me, it just seemed easier. For their relationships, I put with these ions is that they all benefit the body. The ions they all have distinct roles to help the body function right away until one of them is off balance, and then it could be possibly detrimental to your health. All of the ions in our body have to maintain a balance, and when one of them isn't stable, it could potentially be dangerous or life threatening. The signs and symptoms for the chloride hypochloremia, dehydration, fluid loss such as diarrhea, elevated levels of blood sodium, hyperchloremia, also loss of body fluids, kidney failure, and diabetes insipidus, or even a diabetic coma. Sodium hyponatremia is the dizziness, lethargy, nausea, and malaise. Hypernatremia is dehydration, thirst, fatigue, and irritability. For potassium, the hypokalemia, skeletal muscle weakness, smooth muscle atony, and cardiac dysrhythmias. Hyperkalemia, decreased renal excretion, insulin deficiency, and cell trauma. For calcium, the hypocalcemia decreases the block of sodium into cells, increased neuromuscular excitability, and muscle cramps. Hypercalcemia is the increasing the block of sodium into cells, increased bone fractures, and kidney stones. For phosphate is hypophosphatemia, is osteomalacia, which is soft bones, anemia, and bleeding disorders. Hyperphosphatemia would be the same symptoms as above, but also high phosphate levels and related to low calcium levels. Magnesium, the magnesemia, sorry, neuromuscular irritability, tetany, and convulsions. Hyper, for the muscle weakness, bradycardia, and hypotension. The medical importance would be that the ions along with electrolytes play an important role in the body and help maintain the function of cells such as muscle or nerve cells. Electrolytes are essential for function. Ions help the body keep fluids in normal balance as well. Also, the interactions in the body of the ions can cause some unwanted signs and symptoms in the body. A few examples would potentially be hypertension, kidney stones, anything like that. Taking these ions through medications could be a reason why doctors need to know past pertinent medical history and also current, so nothing interacts with one another. And I think I've listed everything that I need to.